My girls, they love to draw. And most of the times they're drawing their family. And it's mom and dad and their sister and themselves. But they never, not once have they not included their dad in the picture. He's here with us. He's always here with us. My cancer journey began with my husband's diagnosis. He passed away in July of 2009. And then a year and a half later, I just noticed a lump. I just looked down one day and sort of noticed this little bump. A week later, my family doctor called me and said it was cancer. And I was like, now it's hitting me. It's like, okay, now I have to deal with my own cancer diagnosis and deal with telling my kids and my family. I went through the surgeries, the treatments, and things got back into a new normal routine for us. It's like, okay, now I have to finish up this grieving process, and I felt like I still needed psychosocial support.
Oftentimes when people think about accessing counseling services, they're hesitant. There's still a big stigma about asking for help when you're emotionally struggling with something. Nonetheless, when you go for counseling, usually you're going to find somebody who has got a very sympathetic and empathetic ear. They listen, they support, they coach, and they're there for you often all the way through.
I first started seeing Dr. Hack shortly after my husband was diagnosed. He's just such a compassionate person that I just felt completely comfortable with. It was so good just to freely talk about my feelings.
I most commonly get referrals to see cancer patients either just after they've been diagnosed with cancer or sometime within the first 3 months of being diagnosed. There's so much uncertainty around their disease and its treatment. How long will I live? Will I have chemotherapy? Will my hair fall out? What do I tell my children? These questions and more can be answered with the support of someone in psychosocial oncology.
Psychosocial oncology is a bit of a confusing term, but if you break it down, it's the psychological and sociological aspects of living with cancer. CAPO is a professional society of committed healthcare professionals. Our vision is to see that every patient and family member will have their needs addressed as they go through the cancer experience, including having cancer-related distress dealt with. We consist of social workers, psychologists, advanced practice nurses, psychiatrists, and many others.
When a family member gets diagnosed with cancer, it totally disrupts the world, the normal world. You don't hear the same, you don't see the same, you don't feel the same. Everything is in shock. As a parent of a young adult with cancer, sometimes I had to accept that the cancer journey that Sarah was on was also about me. I was grateful to have a professional person listen to me about my fears and concerns and worries.
The specialists are grounded in research and the latest evidence, and all of that evidence shows that when we intervene early, we can make a big difference to anxiety, depression, how people adjust and cope on a day-to-day level, as well as the burdens that caregivers and other family members experience when their loved one is going through cancer.
We have a host of group programs and specialty programs for cancer patients who are struggling to cope and manage their emotional responses to having cancer.
I'm part of a support group, and with all the different programs I've taken through cancer care, I've run into other people who are dealing with cancer, and if it ever comes up that I feel that they need help, I would tell them about the psychosocial support that I got and how invaluable it was, and just being able to pour your heart out to talk about every feeling that you have, every fear. Sometimes I just wished I could just go in and just, can you just please fix all of this and make it go away? But, I realized that that's not possible. Dr. Hack has been my guardian angel as well, because he helped me deal with my situation.
Since my daughter Sarah died, it became very evident to me how important the relationship was and still is with the psychosocial workers that treated Sarah. And they still see me. They still care. They're still helping me. And I'm very grateful for that.
With your support, we'll move closer to our vision of excellence in psychosocial oncology care for all Canadians who are affected by cancer.